Hi, welcome back to the channel. I'm Jacqueline. This is Alyson. Our information on who we are is in the description box. We are here to have conversations about mental health. Yes. Honest conversations.
Honest conversations.
And speaking of that, something has happened in our community where we are this week, and Alyson was actually invited onto a number of platforms to talk about it. So I'm actually going to throw this whole discussion over to you because this was your experience, and I think it's an important discussion to have.
It's a tough one.
Yeah, it's a tough one. So everyone
So thank you, Jackie. And so I was interviewed for CTV Morning Live here in our community, and we'll have a link to that.
That's a major news program, just for the people that don't know. We'll put a link to the show down below.
And you might want to watch it. But the story is, and this is public knowledge, it's been in the news, but last week there was a young boy, just 14 years old, very young, who was hanging out with what he thought were some friends at the skateboard park in his community.
At the rec center.
At the rec center. And he was a little bit of an outlier, this boy. Real sweet guy, but I think really wanted friends. And he was kind of connected with this older group of kids that, unfortunately, I believe it sounds like gave him some drugs.
Allegedly.
And which isn't just, this isn't just a, oh, drugs are bad conversation. What ended up happening was he went into distress. And he was
medically distressed.
Yeah. And he was distressed for hours. And unfortunately, and this is the part that's very upsetting to people, is that these, alleged friends actually videotaped this and put it on social media, which is a whole other conversation that we're going to have one day.
We'll have bullying conversations. We'll have social media discussions. We'll get to everything. It's just there's a lot
to talk about,
to say.
And so this boy was surrounded by lots of young people, and
nobody helped.
And unfortunately, after several hours of being in distress, he did die. And so I was on the show, and I actually met with the father, who was just one of the most courageous people I've met. And he's out talking because he really, really wants his son's life to have meaning. And that people remember to talk to their kids, that they remember to help teach their children how to reach out. You see, his son couldn't reach out. He was in distress. And so what we want to talk about too is how to help those other people around, the bystander syndrome, to teach them that they can reach out. And one of the ways we want to do that, and we're going to have this in more detail at another time, because each of these is an honest conversation.
Each one of these that she's bringing up is a whole show in itself.
But we want to talk about, resiliency, how to develop resiliency in children, how to develop critical thinking, how to help them hear and listen to their intuition.
People say, how did this happen?
How did this happen, right? Why? How did this happen? And the thing is that when you are close to a crisis, when you're right there at the epicenter, it's much more dangerous, and you feel much more vulnerable.
Like in your own, to yourself. Like it's an intimidating situation.
For anybody.
For anyone.
And so you get these young kids who they were close to it, and they were vulnerable too, because nobody wants to see that kind of attention turned on themselves. So what you have is, when we listen to our intuition, we can either be keyed into a greater empathy and understanding, and hey, I need to reach out and get help and do the right thing here.
That's that voice, that little voice that right?
Or sometimes it gets triggered into self-preservation. And when I say that, you hear something.
If I step forward, oh no,
danger. Danger.
I'm gonna be hurt somehow.
I'm gonna be hurt. There's danger
if I put myself out there.
And then it shuts people down.
Right.
So it's important for us to understand that. Because we want to teach not just our young people, but ourselves, everybody, as adults.
I often say, and I hope, and I know, I've raised two helpers. I've raised two kids who would have stepped up and helped. I can guarantee you either one of my kids would have done that. I raised helpers, and also I encourage and leave space for the people around me to be helpers as well. so that helpers in whatever way that means to them. Like if it's a bad relationship, or they're seeing somebody in distress in a relationship, or I try and have the people around me be those people that would do the stepping up.
You do, and we do that for each other as part of the community.
Yeah.
So that's what we're trying to talk about, is how do you develop those things?
Yeah, and how do you do that with your children? How do you turn your children into helping people that who will sacrifice their feeling of emotional safety in order to take a step to help someone else?
Right. Who can think outside themselves. So one of the ways you do that is you talk to your kids.
Mm-hmm.
Do not avoid the difficult conversations.
Right.
If I can do anything, if I can get anything across here, it's dive into them.
Yeah.
That's the way we develop critical thinking, empathy, all of it, is through having the difficult conversation. Keeping your child in a bubble and keeping them all childlike isn't necessarily going to prepare them for life. And
it might be actually two things I'm just thinking right now. One of my favorite questions when I'm dealing with my patients, and especially my teenager children patients, I start my question with, I'm curious. Instead of saying like, do you do drugs? I'm curious. What do you think about, what drugs are out there? What do you see when you're in the playground? Do you see people? I'm just kind of curious about that. Instead of making it sound accusatory, you're just really, and honestly, I am. In some ways, I maintain a real curiosity about people, right? And what makes them tick. So one of the ways that I found helpful with my kids is, I'm curious. How do you feel about this? And you could even, as parents right now, take this exact story and change it up to fit the age of your child, and then ask the child and say, what do you think of this? What would you have done? Could you understand why the other people who were walking by didn't help? And have those conversations in advance. So say, what would you do in this circumstance? And that way you are communicating.
And you don't have to figure it all out on your own.
Yeah.
See, that's the thing, is with these young people that are around, you don't have to have all the answers.
Yeah.
And it's okay to, even if you were involved in it, it's okay. You reach out.
Yeah.
You're not going to get in trouble.
Right. To regret and rethink this. And was that smart? Was that a good thing to do? That type of thing. So anyway, it was a very sad event that occurred this week. And we thought it was important enough to just have the start of that conversation with you guys. Yeah. So please provide us with your comments, your questions, anything that you wanted to add about it. That would be great. Yeah. And once again, we say this every time, the purpose of this channel is not to provide medical or counseling advice. We're really here to have discussions and conversations around mental health issues. So it's a sad subject this week. Hopefully next week we'll have something a little more enlightening for us to talk about.
This is part of it, right? Is that, we want, of course, to be uplifting, and we, Jackie and I, believe very much in resiliency and bouncing back, and but we also aren't going to shy away
from difficult conversations.
We're not going to do that. If we did that,
there would be no point to this at all.
Yeah, to be in this conversation, it would be some whitewashed conversation, and neither of us are interested in that. No. So we invite your comments. We invite your thoughts. I'm not going to lie, my heart's been breaking all week from this situation, and having sat with his father and talked to him.
That must have been very difficult.
It was, but he was so, I don't know, this is what I left with, and I even spoke to him about it, and I spoke on TV about it. I ended with, and I'll maybe
we'll put the link down below to this show, but
is that problems are caused from disconnection. The solution is through connection, right? It's through connection.
And that is a great point to end on.
Yeah.
Think about that one. Really give that some thought, because I agree with you. I think that's a great point to end on. Yeah. Bye, everybody.
Bye. We're happy to be connected with you.
Thanks for joining us. Bye.